Next speaker is Dr. Prasanna. Due to some personal reasons, he will not be able to come here, but he has recorded the session and sent it to us. So we'll be playing the video.
So, Dr. Prasanna presenting from the Metaverse.
Thank you, KSOS and Prithvi, for this wonderful opportunity to talk on Metaverse, pedagogy, and AI, the Smart Eye Clinic. So, I'm going to talk about one of my methods which started with cognitive video based learning. So, these are some of my publications which I'll be sharing, video based ones. So, if I'm going to teach what is an iris process and how to differentiate it from a PAS, I show them animated videos showing a fine arborizing strands in iris process, the broad basal PAS at different levels in the angle that it could be, and then take them into a real world where I show them that the fine arborizing strands does not cause rise in IOP nor causes any visualization to the angle structures behind them. Whereas on the right hand side, the peripheral anterior synechiae can cause rise in IOP or can cause visualization difficulty of the angle beneath them. And this is again another video of the pupillary block that is happening here, and this is the cause and this is the acute angle closure attack, which is the effect. So the cause is here and the effect is here. So I am playing this once again. So the aqueous is not able to go through the pupil because of the block, so it pushes the peripheral iris convex and that causes the attack. If we don't treat it here, it ends up with this kind of a picture of a post angle closure attack, of an acute attack. So we prevent it by doing a prophylactic YAG-PA. So that's how we bring in concepts of teaching where we do a Van Eyck's first and then we go ahead, focus on a grip, and then the photo description is done. The firing of the laser is done, and once it is done, see the gush of aqueous that you can see here along with few air bubbles that you can see again here in this part, and that's how the effect of laser happens. And if in case if needed, if you want to enhance the opening by an additional spot size, you can always do the focus, especially on a bridge of tissue here, and then the additional opening is done here, beautifully seen. And then finally the Van Eyck's is again demonstrated, showing that a beautiful opening of the Van Eyck's is noted pre and post the procedure. This is again another video, but this time without the Abraham lens, and in this I've slowed the video, slow motion in the iPhone along with the 700 rupee elephant boat adapter to document the photo description. So can you see this beautiful photo description, the blue reddish flame that you can see here? First time photo description to be visualized in my video that has been published. Again, some scenarios like post-operative ostium evaluation, a patent ostium, and then on the right hand side a blocked ostium. So the bleb may not be the only cause of rise to IOP post-trap, a bleb failure, but even the ostium can go in for an occlusion, and we always need to make sure that we do this, and these are some of my videos of that. Laser training moving into it. So I first show them the anatomy. You see the anatomy of all the 5 structures in the angle, then show them how the ALT spot is done. It is placed between where the pigmented trabecular meshwork and the non-pigmented trabecular meshwork. And in the SLT, what can you see? The spot size in SLT is much bigger than the spot size in ALT. And this is a dyeing procedure of argon laser peripheral iridoplasty. So this is an eye with normal angle. Then after showing the normal angle, I'm showing the oppositional angle. And once an ALPA is done, as you can see here, see how it beautifully opens up. So this is an ALPA. Once it is done, see how it is opening up. So an argon laser peripheral iridoplasty, when delivered, it opens up beautifully. And can we see it from front on view? Yes, we can. The 24 spot size over 360 degree are placed, and you can see the beautiful ALPA procedure from a front on view. Can we see it from a gonioscopic view to understand the concepts better? Yes. This is a gonioscopic view. See how the opposition is relieved after the spot has been placed. So this is how the cognitive concepts learning was started with 2D animations, and then we went into the 3D animations, again another publication of mine, where non-dissectable structures like cavernous sinus, circle of Willis, and even eye for that matter, and the design of it was done using real-time confocal images of the angle as well as the fundus as well, you can see. And then even if you need to paint these structures after a 3D printed model, that can also be beautifully done here as shown in this video. And then this is the 3D model of the circle of Willis, these cavernous sinus, and even the eyeball as well. And then start collecting the autofluorescence and infrared, flect retina, fibrovascular band, retinitis pigmentosa, nerve fiber layer defect, to name a few. You just keep starting your collection and then push yourself further, where we landed up in the Metaverse, the pedagogy, simulations, and AI. So what was it? So can we do something like holograms, because we have now come into the 3D? Can we go into 4D? Yes, and that's when came the birth of these two applications of mine, one for Android and iOS, where you can actually visualize the eye hologram in real time confocal images for the fundus and for the angle in real time. So on the right hand side you can see the mobile camera view that the students are seeing here, and on the left hand side this is the teacher here taking classes with real time simulation. So what a retina surgeon sees on day one, these students can see, and they can go in for an accelerated learning how a gonioscopy structure is seen, that you can see in this hologram on day one. You don't need to know the procedure, but this accelerates your learning with real images of fundus, angle, and whatnot. And again, this is a mobile camera recording of the same, showing the angle. And this is an NTG patient where color fundus, autofluorescence, infrared, all have been added. And then we also validated it and published it. So moving on to the 4D. So with the portable simulator that you connect, that you can see I am wearing it. And then I can not only teach, but also examine the patient's case sheet. So this is an NTG patient that I am seeing the splinter hemorrhage examination of the NTG patient. And then moving on to an RNFL defect examination, where you can see the beautiful RNFL defect can be examined in real time in 4D. And these are things that is up and coming, and again validated and published in the innovation section of IJO. So the flowchart is very simple. A patient enters into the hospital. From the database, our software converts it into an hologram of fundus and OCT together, where you extrapolate the OCT slices from the fundus, and you can actually counsel the patient before and also after. And multimodal imaging, not only a single color fundus, autofluorescence, infrared, low vision rehabilitation counseling, especially neuroanatomy teaching and neuroanatomy pedagogy. This is very, very good, where the complex neuroanatomy channel was studied, and we created this in total 3D, and now it is available in 4D as well for teaching. And again, one of my surgical simulators, when I did one of my mixed cases, I did have a stent drop, but all's well ends well. I place the second stent first, and then you see the challenges is if you don't close your trocar, again I lose it in my phaco wound. So these kind of drop stent cases gave me an idea. Of course, I placed the stent rightly at the end in this case. I went back to my drawing board and I wanted to make a simulator for MIGS, because there is no such simulation models for it. So this is a metaverse where you can see not once but twice. You can practice the implantation of the stent multiple times before placing it or going for the real case. So this is me practicing the implantation multiple times, and when I'm in the right channel, a green cue comes in the image behind. So practice this multiple times, and then when I go into my real-time surgical field, my hand-eye coordination is better and I'm able to deliver a good result. And this is a patent-protected innovation of mine, also published in IJO. So the Gen Z kids, as you can see, this is my daughter, they love to play with this, of course, for their own reality, but this is up and coming, and on terms of it, we need to keep evolving and innovating, where this is one of my subtractive tools. So the Gen Z kids, they want the subtractive kind of a thing, where they subtract structures that they want to only see, rather than me giving them a particular image, where that led to the innovation of subtractive learning, where they can choose and subtract, and we created a brain model, an eyeball model, as well as you can see the neuroanatomical model as well. And not only that, in the camera, the phone camera, you can take it forward and take it back. So by doing it, you actually do a direct ophthalmoscopy simulation as well. So this is again another direct ophthalmoscopy 3D smart simulator that we made, along with the e-counseling devices that you can see behind me on the right hand side. So this is the metaverse. Welcome to the metaverse. We are at a very, very beautiful time, and this is my team which helped me in making this, and we have published it, and it's all open access and available. Along with the metaverse, to touch a few points on AI, which is a software application that you can see behind me, we have used human in the loop training, where humans taught the AI and humans validated the AI. Two human interfaces that we use to not only diagnose the glaucomatous defects, but also give the intricate parts with good sensitivity and specificity. And again, we are moving in with angle and as well as OCT, and this is the UBM ASOCT anterior machine imaging multimodal angle AI that we are using for ophthalmic diagnostics and interpretation. So to summarize, my dear friends, we are not at any war with anybody. This AR and AI which we have developed within 60 seconds, which we are able to get the diagnosis and the models ready, they are all not an arm wrestling between the doctor and the AI. We are all going to work together for a better humanity, and this is what is my vision. And we have started our own startup called the Mahatma Center of Moving Images. You can catch us at www.mcmi.in for our pedagogy, diagnostics, simulations, and artificial intelligence models which are open access and very much available to all. And you can also catch me at my YouTube channel, which goes by my name, Prasanna Venkatesh Ramesh. Thank you once again, KSOS, for this opportunity, and Prithvi for giving me this wonderful chance to talk on my metaverse. Thank you.
So